My name is Marc Bonaca. I'm a cardiologist and a vascular medicine specialist at the University of Colorado in the United States. I'm a professor of medicine, director of vascular research, and the executive director of CPC. And I'll be talking about a new digital nutritional cognitive behavioral therapy for patients with type 2 diabetes. This is a digital therapeutic. It's an app. It's made by a company called Better Therapeutics named BT001. And it's an app for patients with diabetes, but it's very different than many that are out there that have you track your calories or just follow your blood sugar, other things. Really, what this app does is it delivers something called cognitive behavioral therapy or nutritional cognitive behavioral therapy. Now, cognitive behavioral therapy is actually something that's been around for a long time. And what that really targets are behavioral or things such as substance addictions, pain, other things like that, where patients have core thoughts and beliefs that are sort of misguided, if you will, and those lead to unhelpful behaviors. And those unhelpful behaviors manifest in things like food choices, what you eat, when you eat, exercise, and that perpetuates the cycle, the progressive cycle of type 2 diabetes. And what this app delivers is a personalized, structured cognitive behavioral therapy that helps patients to help themselves by resetting those core thoughts and beliefs that then translate to helpful behaviors around food, eating, and exercise, and actually can help to lead or reverse type 2 diabetes. And that was the study that we did. So this was a randomized controlled clinical trial, so that it was not just, single arm, but it was a very rigorous registration type trial randomized to BT001 or a control app. There were 12 sites in the United States that recruited almost 700 patients. Eligible patients were those with type 2 diabetes that were not on prandial insulin or weren't unstable, but otherwise it was quite liberal in terms of who was included. Generally, people with an A1C that was 7% or above and that were on stable anti-hyperglycemic therapy. Well, we learned in terms of key findings that use of BT001 relative to control as a randomized trial led to a statistically significant reduction in hemoglobin A1C with a delta between the control group and the BT group of about 0.4% over the first 90 days. And then in this current analysis, we learned that that delta, that benefit was persistent through actually 180 days, and that the BT group continued to have a reduction in hemoglobin A1C, and the delta between control and BT001 remained statistically significant. And so we learned that there was a persistent reduction in hemoglobin A1C, but that's not the whole story, because the other key finding is that because physicians in the study were able to see the hemoglobin A1C and change medications, obviously in the control group, there was more medication intensification. And so we saw that there was a 7% absolute reduction in the need for new or intensified anti-hyperglycemic medications with BT001 that was statistically significant, highly significant p-value. So lower A1C, fewer new medications or intensification of medications. And then along with that were statistically significant and important changes in body weight, about a 4-pound difference in weight between BT001 and control, and a statistically significant reduction in blood pressure. And so all of those findings were consistent. And actually, when we asked patients how they felt using structured patient-reported outcome measures, there were improvements in their physical component scores as well as depression screening. We hope that these findings have a profound impact in clinician daily practice. There are a lot of new and important medications out there for diabetes, and of course that's an important development. But the foundation of treatment for type 2 diabetes is lifestyle modification. Yet for all clinicians, and I speak as a clinician myself with many patients with diabetes, having patients change behavior based on interactions in the clinic that last a few minutes, it's very difficult and not successful in the majority of patients. And in other more intensive measures like traditional cognitive behavioral therapy, it's just not feasible. It costs a lot of money. It requires people come into the hospital or the clinic, spending multiple sessions per week. And so it's just not scalable. And this then becomes a tool that a clinician could simply prescribe, and that would enable a patient to access nutritional cognitive behavioral therapy in their own home, on their own schedule, in a very personalized and private way, and really promises to move the foundation of behavioral change to the forefront and make it feasible and scalable for clinicians and patients alike. And so we hope this becomes a transformative technology. My take-home message for this would be that we can broadly achieve behavioral change in type 2 diabetes as a way of reversing the core problem. And we can do it by leveraging technology and established mechanisms of action, such as nutritional cognitive behavioral therapy. And now we have proof that that approach works. And the next question will be how we integrate it into our clinical practice. Two things in terms of future directions. First, unlike many of the therapies that we think about for cardiometabolic disease, here we saw lower rates of adverse events with the intervention than control. And that was quite a striking finding. And it begs the bigger question of, okay, you can lower A1C, lower body weight, all of those things. What does that translate into long-term in terms of healthcare utilization and outcomes? And ongoing now are several real-world evidence studies using this exact technology to describe the healthcare utilization in real-world patients. And so the next step, I think, will be to understand the broader implications of BT001 as a foundational therapy in patients with type 2 diabetes.